Have you had to change from Wegovy to Zepbound or Zepbound to Wegovy? How do you transition between the two? I'm going to break it down for you. Hi, and welcome to my channel. I'm Dr. Megan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based, fact-based answers to your weight questions, you're in the right place. Welcome. Okay, so this year, a lot of insurances have changed what's on their list, and a lot of people have had to change from Wegovy to Zepbound or Zepbound to Wegovy, especially around July this year, 2025. So for those of you who are going to need to do this in the future, I'm just going to walk you through how I think about these things and what I do for my patients. In general, I have a very tailored approach. It is not one size fits all, and there really is no direct conversion, and there's no chart that you can just like, whoop, like it's an easy conversion swap. It really depends on a couple different factors. So let's go through them together. In general, my approach is looking at what the patient is currently on, looking at the moderately equivalent dose would be on the other medication, and then backing it down a couple doses. And that's because one, especially if it's Wegovy to Zepbound, Zepbound is a stronger medication. But two, even if it's Zepbound to Wegovy, I don't know how they're going to do on this medication. And the last thing I want to do is blast somebody when they are, used to being on a pretty stable dose. And it's really important for when I'm thinking about these medications for people that we're really thinking about them for the long term. I need to make sure that this is something that somebody can stay on forever, because if they go off of it, it's not going to work anymore. So I would much rather have somebody have a very boring transition and no real weight loss and nothing really happen, then maybe aim for getting a little bit more weight loss initially and have them feel really sick. I'm just not interested in that. I don't think that serves a patient's long-term goals. Also, I tell patients this, it's really, really, really important that if you are changing between these medications, don't expect anything big to happen. And what I mean by that is, let's say I have a patient on Wegovy 2.4 and they're changing to Zepbound, and they've heard, oh, people actually lose traditionally more weight on Zepbound. Yes, but if they're on Wegovy 2.4 and let's say they're, standard patient, they've been doing well, no significant issues, I'm usually always going to change them to something like Zepbound 7.5, which is a little bit lower than the equivalent dose. I might even go down to 5. And my goal is that it's a seamless transition as much as can be anticipated. And they might, number one, not lose any weight, or number two, they might even gain a few pounds. And so I just want people to know that I don't want them to expect any big radical weight loss changes over this transition. And actually, the weight loss, especially if they're going from Wegovy to Zepbound, they might not notice additional weight loss for until a few doses have gone by, because that transition period is really about letting their body adjust. And so I'm not really looking to advance the weight loss at that point. I'm just looking to make sure that they can tolerate it. So if I have a patient and I'm meeting with them a month after we've done the initial transition, and they come to me and they're like, it's not working, I don't know what's going on, I got on the scale, I actually gained 3 pounds, I am not worried about this at all, because I know that if they're on the 7.5, we've got a lot of way to go until we actually see how much that medication is going to work for them. So even if they gain a few pounds, for me, it's not a big deal. but I do like to let people know that up front. Also, for my patients, I don't taper them off and then start them on the new medication. I don't taper everybody off Zepbound and then start them on Wegovy. In general, I don't need to taper people off the medication anyway. Even if somebody is really not tolerating it well at all, I just stop it. I don't taper, I just stop it. Now, for somebody who's transitioning from one medication to another and had a really hard time with that first medication, often what I will do is stop the first medication and then start them just at the lowest dose of that second medication, because that's somebody I really want to see. Let's give them the best chance at success possible at tolerating this medication, because if they're already having an issue on the first one, I'm not sure how it's going to go on the second one. So let's go really low, as low as we can, just to see and give them the best shot at this medication potentially working for them. So overall, for the normal patient, like if somebody's on Wegovy 2.4, generally I'll start them on Zepbound 7.5. If somebody's on Zepbound 15, generally I'll move them to Wegovy 1, maybe 0.5. It depends on the person. But here's the other thing. It also depends on access and how much risk a patient wants to accept. So I also have some patients who, they need to order a 3-month supply for their insurance. And so we'll have a discussion and they'll say, you know what, I'd rather aim a little high so I get that 3 months of the medication and I can stay at a higher dose. And those are people that, in general, they've tolerated it well, and we both feel like it's, the benefits outweigh the risk, versus those other people who are just having a really hard time with the first medication, and then I'm going to start them on the lowest. So overall, it's very tailored, it's very patient dependent, but I look at the quasi-equivalent, because there's no real direct comparison, and then I'll back it down a couple doses. And very important to let the patient know, hey, this is a transition phase. Let's not expect a lot in terms of weight loss. We just want to make sure that you can tolerate this and that you're not miserable. So thank you so much for watching. What a great question. If you have other questions, leave them on this video, leave them on another video, and I will add them to the list. If you want to work with me directly, if you're on a GLP-1 and you're still feeling like, oh, my food could be better, or can't get myself to the gym, I'm leaving results on the table. If that's you, we should talk. I will leave all that info down below. Thank you so much for watching. If you're not subscribed to this channel, subscribe, because it's the place for medically based answers to your weight questions. Thank you so much for watching, and please be well.